Good evening. Welcome to Dr. Gor Show. Today we are going to talk about a topic, safe liposuction. Really? Is there something like that which exists? Yes, it does. So, as a medical director of medical spa, I have looked into different options for weight loss, for weight maintenance, as well as for beautifying or making yourself look better. And during that process, I've talked about cool sculpting, I've talked about laser hair removal, painless way, vaginal tightening, stress urinary incontinence treatment, as well as treatment for cellulite, facelift, non-surgical facelift, etc. Now I want to talk about a safer way to do a liposuction. So liposuction in general is a procedure where small incisions are made in areas that there is a lot of fat accumulation just below the skin, and through those cannula we suck out the fat. As simple as that, liposuction. During traditional procedure, when liposuction was done, what happens, there are multiple small incisions which needs to be made. We passing the cannula under the skin and sucking out the fat. Now during that process, what happens is a damage to blood vessels, and there is a little bit excess bleeding. Also, it leads to what we call as hemodynamically unstable patients sometimes. That means that we're sucking out too much fluid or too much fat, along with that too much blood, which makes patient anemic, and sometimes a really bad complication, including death, has happened. And that's why most kind of shy away from traditional liposuction, because the recovery time is longer, there is some amount of garment for some amount of time is needed, there is bruising, there's general anesthesia which is given, and if you have blood pressure issue, diabetes, this all procedure gets a little bit complicated because of your cardiac underlying conditions or your general health status. And that's why I usually prefer non-invasive, which is cool sculpt or sculpture, as a management tool for unwanted bulges and body sculpting. But there is some good news. We have RAFL technology, which is radio frequency assisted liposuction. So RAFL is the other short name we can say. What is radio frequency? Now, any waves, be it ultrasound waves, laser waves, radio frequency waves, these are targeted like microwave waves. These waves are targeted from one point to the other in that area which we want the desired treatment, and that specific area where this energy is transmitted, the results are obtained. So there is a different modalities of energy delivery, be it electric, be it radio frequency, ultrasound guided, laser, or radio frequency guided. Now, what all this energy does? Radio frequency, unlike laser, is colorblind. That means that it can be used for any skin type. As we've discussed in the past, there are different skin types called Fitzgerald scoring from type 1 to type 6. Most Indian fall in type 5, type 6, which because of our melatonin, the pigment on our skin. So radio frequency is colorblind. That means we can use it for somebody with type 1 skin to type 6 skin. And that's the beauty of radio frequency. Also, because of the heat it generates, it gives us a desired effect in that area. And we'll talk about what is this desired effects on the skin at the level of dermis, and why you like to use this technology along with liposuction. So radio frequency assisted liposuction can be done in a larger areas as well as small areas. This procedure, unlike traditional procedure, can be done through very, very tiny cut or no cut. Traditionally, anywhere from 3 to 5 centimeter cuts I have seen for traditional liposuction, especially for large area like tummies, thighs, buttocks. Here, the incision is anywhere from 1 centimeters to 2 centimeters. So it's much smaller than traditional liposuction. Number 2, because of the heat and radio frequency, there is coagulation of the blood vessels. So amount of bleeding is very, very minimum. Recovery is much faster. The duration of use of the clothing, that special clothing or garment as we call it after the procedure, is reduced to very few days. Most people are ready to go back to work within a day or two, compared to the traditional liposuction where you can be off up to 7 to 10 days because your big incisions are leaking, they are draining, you are anemic from the weight loss. So there's a huge difference. Also, there is no general anesthesia. It's an awake procedure thanks to tumescent fluid, and we're going to talk about what's a tumescent fluid. And that makes the procedure much painless, safer, as well as less blood loss, and patients are much calmer because there's less pain. Tumescent fluid was described and by Dr. Klein, a plastic surgeon. And what it means that we are putting fluid, which is mainly saline. Along with that saline, we have added some amount of lidocaine, which is anesthetic injection, with soda bicarb and epinephrine, which is like a vasoconstriction. This fluid is prepared ahead of time, calculating depending on the weight of the patient, what area we need to treat, and the maximum dose is calculated. We never go beyond that maximum dose. Reason being that too much of fluid goes inside and too much of lidocaine goes inside one system, which can then lead to lidocaine toxicity. So we never give more than 35 milligram per kg setting for a patient which needs to be treated. So this tumescent fluid, what is the advantage? So this solution which we described with the ingredient is prepared, and with the small needle just below the skin, this fluid is either injected through the special needles or spinal needle to make a layer in between the skin and the subcutaneous tissue, which increases the distance between and the underlying connective tissue. That gives us a depth to work with our probes for radio frequency, or some people use laser device for that. So that's the advantage of using the tumescent fluid, because it increases the thickness that we can work on. Number 2, because it's an anesthetic solution, the patient gets great numbing of that area. So they usually don't feel anything, and that's why they don't need general anesthesia. Some people, we give them anti-anxiety medication or some sleeping pill to kind of calm them down. But most people are fine. Some people we have given Pronox, which is oxygen nitrous oxide gases, which used to be traditionally called as laughing gas, to calm their nerves. But that's usually in a rare occasions. Most people are fine with the tumescent fluid and just oral kind of relaxant anti-anxiety medication. Number 2, because of the tumescent fluid, it also helps with lipolysis. So it makes the current pass easily into the fat area. So it increases the thickness, it gives anesthetic, and also it improves the technology because it makes fat more permeable to the radio frequency. So that's the advantage of tumescent fluid. So radio frequency assisted liposuction is usually most of the time done with tumescent fluid because of those advantages. So what is radio frequency probe or a body tight? So as I said, this frequency can be used for larger area, and when we use a larger probe, the machine is called body tight, where the cannula is longer, anywhere from 17 centimeter to 22 centimeter. The thickness is anywhere from 1 to 2 centimeter. So we have to make incision accordingly. Now, if you have a smaller area, so say bra fat, arms, above the knee, chin, jowls, or you have too much fat, your cheeks are very chubby cheeks, which as an adult you really don't like it. So those instruments at that point are called either face tight or AccuTight. They are 0.9 a centimeter in thickness, and the length is anywhere from 10 to 12 centimeters. So we can work with the smaller areas. Also, this has been used extensively in gynecological needs. So when there is a fat over the mons pubic or in your pelvic area, you have a lot of fat in that area, even your lips, the labia majora and minora, if they are disfigured or asymmetrical, this can be used. So that machine is called AccuTite. So we have BodyTite, FaceTite, AccuTite. So these are the machine with the different sizes of the probe and the length which have been used. Now going through the technology itself. So as you can see in the pictures, the radio frequency is passed between the internal probe as well as external probe, while the energy is passing from inside to outside is heating up the area. Now inside we want temperature to go up, depending upon if it's a body, anywhere from 55 to 70 degrees centigrade, but if it's on a face or a neck, then we keep it at 50 to 60. That is the internal temperature. The external temperature can be anywhere from 35 to 40 degrees. Now, why there is a difference in the temperature? So this goes back to the technology. As you can see in the picture, when the radio frequency waves are given in the dermis as well as subdermis, what is happening? It is restructuring the collagen in that area. It is coagulating the blood vessels. It is affecting lipolysis, fat liquefaction, and it affects on the fibroseptal network. So as you can see, this fibroseptal network holds the skin firmer, tighter, and that loose, saggy skin is no more there. So this works from inside, right? It is affecting the skin from the level of dermis and subdermis, but also the external probe helps to tighten the skin and also improve the reduction in the pore size, reduction in superficial fine wrinkles, as well as texture of the skin. So that's why both the external as well as internal probe temperature is specified at different temperatures depending upon the area. So it's helping the skin stay tight from superficially as well as by support from the dermis and connective tissue. So typically a patient who comes in for consultation for either body contouring or for minimally invasive awake radiofrequency assisted liposuction, we go through the history, we go through what are the expectations, is this procedure going to be possible? We look into contraindications. The contraindication are if you have really a pacemaker or any atrial fibrillation devices, a metal object if it's injected in your body, if you have an active skin lesions there, be it active herpes or eczema, then we really like to treat that first before undergoing any of the skin procedures. Number 3, if you have really uncontrolled diabetes, blood pressure, then you really don't want to undergo procedures, any procedure, till your blood pressure and sugars are well controlled. HIV infections are relatively minor contraindication. You just have to make sure the patient is stable, understands, and also you take extra precaution as far as your staff is concerned and sterilization of documents are concerned. So these are some of the contraindications which we go through. We take before the procedure pictures, we walk through the procedure with these people, and day before the procedure they start antibiotics. On the day of the procedure they come with a very light meal. We give them anti-nausea medication, we give them a little bit of sedation, and we really give them anti-anxiety medication and some painkillers. After that, the important part comes marking of this patient. As you can see in the pictures, when one is standing up, the area looks much different than one is lying down, and that's why we take pictures when somebody is standing. That way we can see exactly where are the bulges, where exactly we need to go in, and where you want to do the procedure. Because once we put the patient flat and once we inject the tumescent fluid, it's going to look much different. So marking the area and talking with the patient and patient understanding what we are doing and has right expectation about how much we're going to lose the inches and what's going to be the desired effect on the skin. We're going to take a short break and we'll come back and talk about the procedure. Welcome back to Dr. Gor Show. Today we are talking about a safe liposuction. Yes, there is something called a safe liposuction. What we call is awake, minimally invasive, almost no cut required, radio frequency assisted liposuction. So far we have discussed the technology behind it, where can we do it, what are the different kinds of probes. We've gone through contraindication, we've gone through pre-op procedure, marking. Now, once the patient is flat, we of course scrub the patient, we keep them warm through the sheets under the patient's bed, and then we start doing infiltration of tumescent fluid. So once the body parts are scrubbed, the surgeon scrubs, and we make tiny incision, so that way we can either introduce spinal needle or we introduce the tumescent fluid. Most of us just give a local anesthetic, like how a dentist makes a small needle and puts in a local anesthetic to do the procedure. Same way we make a tiny probe needle injection, so that way we can pass in the spinal fluid. And this tumescent fluid is injected in the dermis as well as some amount of subcutaneous tissue. If we see a lot of orange peel like Puget orange effect, that means we're not in the right plane. You need to go a little bit below that subdermis to have a great effect. When the tumescent fluid is enough for that area, you'll see the skin gets paler, it's soft but it's tight and not much Puget orange or that orange peel look. After the tumescent fluid is introduced, we kind of change the position and inject in different areas which we need to treat it. Every time we move the patient, we scrub the patient. So as you can see, if it's a right thigh, we do outer thigh, we do left inner thigh, then we turn the patient, that way we do left outer thigh and right inner thigh. So now we've injected the tumescent fluid. Then we go back to the area where we need to do the liposuction. So now we'll make a small cut and put in the BodyTite or a radio frequency device in that area, making sure there is a sterile feel, and we put a sterile gel on the skin to prevent any skin burns. And we are doing the procedure, as you can see in the slides and the picture, that the internal temperature, we monitor it. There is an audio feedback once the temperature is reached, and then we go ahead and do the external temperature monitoring and we treat the external area. So we are making sometimes slow movement passes, rapid passes, depending upon what area we need to heat. Are we heating the deeper connective tissue and dermis, or we are doing the skin? So we go from this areas one to the other. So we can start again, as I said, right outer thigh, left inner thigh, left outer thigh, right inner thigh, or we go from the right abdomen flank to left flank to lower abdomen to upper abdomen, depending upon where we need to treat the area. After we've achieved the lipolysis and radio frequency, as we've discussed, it helps reduce the amount of bleeding because it's coagulating the blood vessels. It is enhancing its effect because of tumescent fluid, so the lipolysis is much quicker. That reduces the operating time, less bruising, and safer procedure. Also, we are getting desired skin effect, right? So this is really good for skin tightening. You know, if we do traditional liposuction, the skin still is lax and it falls down, there are wrinkles, and it really doesn't look good. that's why this radio frequency helps to tighten the skin through the outer layer of the skin, epidermis, and also through inside, right, through dermis and subdermis, because of connective tissue, fibro elastic network, as well as rearranging the collagen, as you can see. Now, to show the effect, there are these few slides which shows the effect on the fat, on the connective tissue. We've used it for open procedure to show how nicely, as you can see in this slide, that the subcutaneous tissue is firmer, smaller, and less bleeding. And that's the desired effect which is happening in all the areas where you want to do liposuction. So after each and every area which are treated with radiofrequency devices, then we again go back to those areas with the suction cannula now to suck out the fat which is there. But it's much easy. Imagine yourself trying to cut butter when it's immediately out of a freezer, while it's very difficult because it's so hard. But if you have left that butter outside for a while, or you have gently warmed it up a little bit, it's nice and soft, so it's easy to cut, right? Same way, if you're just trying to suck the fat out without doing radiofrequency before, which is in case of traditional liposuction, what happens? This fat which is hard, which is attached with the blood vessels, you are kind of sucking it out, making it very difficult, more traumatic, more bleeding, more damage, and unsafe. While with the help of radiofrequency, you have loosened up that fat, you made it a little bit liquidish. Also, you have coagulated the blood vessels, so it makes it much faster, much safer, as well as less bleeding and much faster recovery time. So once you suck out the fat, you're keeping track of how much fat you have sucked out. Remember that some of it inside that suction fluid is also your tumescent fluid that injected before. So as we are doing this procedure, we are keeping an eye, we are talking with the patient gives you feedback how it is, and we can see how the skin is tightening, how the area is looking much better and much smaller. You're going to see much better results, of course, by 3 and 4 weeks, when all the swelling has gone down and finally you are seeing the retraction. But even as early as few days, you'll see the reduction in the girth, reduction in the amount of subcutaneous fat and skin tightening. But ideally, you will see the results anywhere from 4 weeks to 6 weeks, a complete result. But it's much faster than body sculpting. We've done the procedure and seen result as soon as 2 weeks. So if somebody has an event and they want to look great quickly, this is the way to go. Also, as far as the pricing is concerned, either the body sculpting, which might require 2 or 3 sittings for some people, to a radiofrequency assisted liposuction, which is only one-time treatment, almost comes to the same thing. Here it is a little bit more invasive, and you might need like a day or 2 to recover yourself, compared to body sculpting, where there is no cut, there is no anesthesia, patient is up and around. So it depends on what is required to be done, what the patient desire it. I have some people who would absolutely not get any incision or any blood loss. They would not mind coming for multiple treatments in the same area, and they are willing to spend that money. And there are some people who want instant result. They really don't mind if they have to undergo the knife, but they want it as a safer procedure and a guaranteed results, which we can give it through liposuction, because we are sucking the fat out right in front of us. So there is no one treatment which fits all. It depends on which area you want to treat, where is the amount of fat which needs, your medical condition, your ability to take time off or not, and how soon you want the result, the safety of the procedure, and also financing options, etc., comes in the role. So we've talked about safe liposuction. Please make sure anytime you're going to your provider, ask these questions: what are the different options, surgical, non-surgical, safer way to do it, as you can see, the technology is evolving very, very fast, and something which we used to do as a traditional treatment, we no longer do it because there are much better, safer options available. So I will strongly advise you guys to please go for a consultation with the right person, look into different technology that person has. If they have only one technology, always doubt that, because they have a very limited experience. You want to go where somebody has experience with different technology, that way they can choose the one which is right for you, because as I said, there is no one dress which fits all, and that's why you go to the right tailor or a right shop. So this show will be on YouTube, www.youtube.com, and look into Dr. Gor show. And please talk to your friends, talk to your provider, and get the right treatment. This is Dr. Hetal Gor. Till next time.